Hello, my name is Goedeke. I'm the first author of this paper, and I'd like to give you a short overview about our study, which assesses the potential of multiphoton microscopy in the evaluation of pediatric solid tissue in comparison to conventional histopathology in an international online interobserver trial. Research has well established that surgical excision is an integral part of treatment for most solid tumors, and that the goal of surgical resection should be the eradication of cancer, both gross and microscopic. The golden standard of frozen section biopsies to determine clear resection borders is stressful for pathologists and time-consuming. Multiphoton microscopy may bridge the gap between surgeon and pathologists in the future, bringing pathologists to the patient's bedside and offering surgeons an instant microscopic characterization of the tissue of concern. This laser scanning technique is already being used in diagnostics in dermatology, but not yet in the operating theater due to the lack of suitable devices. However, this seems technically feasible in the future. So far, multiphoton microscopy has not been studied for childhood tumors and other pediatric indications. In our previous proof of principle pilot study, we described for the first time the use of multiphoton microscopy as a promising new tool for the additional evaluation of solid pediatric tumors. The primary objective of the present study was to go one step further and to evaluate the diagnostic accuracy, feasibility, and interobserver congruence of multiphoton microscopy versus conventional histopathology as the gold standard for normal pediatric tissues and two typical pediatric solid tumors by international attending pediatric pathologists. MPM and H&E staining were performed by institutional standards on formalin-fixed and paraffin-embedded tissue. For the survey, we used QuestionPro software. 38 international pathologists from 13 different countries fully completed our survey. Study results showed that currently and without prior training to the novel method, pediatric pathologists are more accurate in making a diagnosis on conventional H&P staining, but they are able to discern certain key features on MPM as well. While MPM lacked sensitivity for diagnosing the tumors, it seemed to be quite specific. Further studies are needed.